Hello, ladies and gentlemen, and thank you very much for joining me today on this live podcast on how to never need to go to a medical doctor. So, what we're talking about here is not being against medical care. What we're talking about is self care, not medical care. It means not having to go to a medical doctor. If you have to go to a medical doctor, go to a medical doctor. You break your leg, go to a medical doctor. If you have a car accident, don't go to your acupuncturist. Go to the hospital. So there's a time of medical treatment, and surgery can often be necessary. And we have some of the best surgeons in the world. But as people are becoming aware, there's more to healthcare than medical care. In fact, medical treatments are usually for more advanced conditions in the later stages and offer no sense of prevention at all, which is maybe in their better interest because, they're kind of waiting for the condition to get worse. A lot of times when a medical doctor says, come back in 6 months, I want to keep an eye on it, they're basically saying, and I got this from a medical doctor who told me this, it basically means the doctor believes the condition's going to get worse and just come back in 6 months. So the numbers are in a range they can now give you the medication. So again, they're not into being proactive. That is going to be your responsibility. So we could really call today's talk self-care, not medical care. And what are we gonna? And what does that really equate with at the end of the day? It equates with more, living longer, better quality of life. Because if obviously you're taking care of yourself and not taking medications, then you're going to have a better quality of life because you don't have all the side effects of the medication, urinating at night, foggy brain, toxic liver, slow kidney failure, etc. Known symptoms, common symptoms. There's plenty to all the medications. There's always a price to pay with every medication. So learning to take care of yourself, that's what this is about today, self-care. Now, I'm 62, and I just did the math, and I haven't seen a medical doctor for 45 years. So I'm going to share a little bit with what I've been doing for 45 years to not have to go to a medical doctor. I did fall off my horse, broke a few ribs, and I was thinking about it because I was in so much pain, but then realizing there's not much they can do anyway. I just took my pain herbs, my anti-inflammatory herbs, and some pain relieving oils, and I slugged it out for a couple weeks and got through that. So let's talk about what you would need to do. It really starts with a change of thinking. To have self-care, the first step is change the way you think about healthcare. You have to take responsibility yourself. Just running off to the doctor every time you have a cold or a sore throat or a little ringing in the ear or, some foot fungus, then you're not taking responsibility for taking care of yourself. So that's what we're going to talk about today. What does that entitle? Well, let's just go through a little list here that I made. One, you have to be proactive. You can't just sit around and wait for your high blood pressure to get high. You can't just suddenly go to a doctor and find out you had high blood sugar. You have to be proactive. You have to be checking your blood pressure. You can see I have a cuff right here, and I have the little blood sugar tester in my bathroom, and I just randomly test my blood pressure and my blood sugar, and I have found that they started increasing, and I had to determine why they were increasing, and never really had to take any herbs for it, but I did notice that they will go up, blood pressure, blood sugar, for various reasons that you don't even think about too much. Like I was drinking a lot of coconut water all summer long. I mean, I just got hooked on it, these big bottles of coconut water. And then at the same time, I had a friend coming over, was giving me these yerba mate drinks, and they had a little high in sugar, and we were having them in the morning while we were working on the ranch. And then I was drinking the coconut water, and then I measured my blood sugar in a bathroom, and it's like, what? 140, 145 fasting in the morning. That's not good. So I couldn't figure out what it could be except the coconut water and these sweet yerba mate drinks. So I cut them out. And then my numbers came back down. But that's what you need to do. You need to be proactive. You need to be on your own health. You need to be checking all the time. Everybody should have a blood pressure cuff in that house. Everybody should have a blood sugar a test kit. And now they have the monitors that are monitoring 24/7. You can see the results of your blood sugar on your phone. So you could go eat a meal and see your blood sugar spike. You could go eat some ice cream and see it go over 200. And I was talking to a medical doctor the other day, and I said, doctor, how high does your blood sugar have to get before it's actually damaging the nerves? Because we know it's damaging a lot of tissue, but particularly the nerves and even brain cells. High blood sugar is just really detrimental. And, get tingling, numbness, neuropathy, and then the brain cells, the nerves cells can be literally damaged. And then you have all types of, pain and inflammation. So I was asking a doctor, how high? And I was thinking maybe over 200, he would say, maybe 250, because I've had people with blood sugar numbers close to 300. I'm thinking, how's this guy still walking without pain? Now they have a little pain, but they, tough guys, they suck it up. They don't complain, but these numbers are high. They don't even know it, or they just find out. But this medical doctor, who I respect, said, anything over like 150, 160, you're already starting to talk some level nerve damage. And, same with blood pressure. You let that blood pressure get up too high, it can start affecting your kidneys and, other organs in your body. So, and of course, you can die from it. So that would be the first thing. Be proactive and keep testing yourself. At least, test your blood pressure, test your blood sugar. I would say that's first. And second, don't delay self-treatments. I see this all the time, even with my own patients who really, love me. I've treated them. I've treated their family members, treated their mother, their husband, their kids, and they'll still delay contacting me when they have a health issue. I see it literally every day. So, just recently I had a client, and she says, I'm on a Z-Pack. I go, what's going on over there? I just saw it 4 months ago. And we were talking about arthritis and sleep and digestion. And of course, it was not cold then. And then they go, I got pneumonia. And now that I'm on the Z-Pack, I become constipated. I've got gas and bloating. I had a heavy film on the tongue. So they wiped out all the intestinal bacteria. So here we have a person they delayed even going to the doctor, not alone delayed coming to me. When they got the cold and flu, they could have contacted me. I could have just sent them the herbs, or even being more proactive. You should be having these herbs ready to go. You can see I'm sending all my thousands of past clients emails multiple times during the fall and early winter to have immune tea. Now I have two immune teas. I have Ayurvedic immune tea and I have my Chaga immune tea. Both are very nice, very effective. And I personally have 1 cup a day, and I've gone decades without even a cold. But I'm taking my immune tea every day, and I'm taking some other immune boosting substances all during the winter because it gets quite cold here below freezing, South Texas. And I go out a lot in the cold weather because I have a lot of animals outside that I'm always concerned about when it's cold. I have to put the heater out there for them and make sure it's all working. And I still don't catch a cold or runny nose. So, but I'm proactive. I'm drinking my immune tea all the time. And I have a cold and flu tea that I may not take it, but I've got it like sitting right there ready to go in case I start to feel any type of sore throat, anything in the early stages. I would say this is another tip, which is really the same subject. Don't delay. act fast. Don't think ever, oh, let me just see what happens by morning. No, that's a big mistake. If you even have a sore throat, I was treating myself, and first thing I ever learned to treat for myself, probably in my early teens, was a cold and the flu. So people all were getting colds, and I was starting to learn herbs like echinacea and golden seal. You don't hear much about golden seal anymore, but at the time, those were the two big ones that I was into as an early teenager, and was making teas to avoid. Then I threw in elderberry and ginger and cinnamon and licorice, and I made like a little immune teas and things like that over time. And that's how many of my immune teas evolved. Later on, I put in the chaga mushrooms. But and that was my first thing I ever learned to treat, was a cold and flu. And the first thing I ever learned to prevent was the cold. So, you could say 45, maybe 50 years, I've been treating colds and flus for myself. And now, of course, professionally, and very easy to do. There's no reason for anybody to get the cold and flu if you're prepared, if you have the herbal remedies ready to go. You can't say, oh, I'm going to go see how it is tomorrow. You have to act fast and catch these conditions in the early stage. I can't emphasize that enough. And that also means, being prepared, having some herbal products ready to go. And not, now, of course, I have to ship to people. So I still get people saying, oh, I got the flu. Oh, I got an earache. Sometimes I just send them to Amazon and just tell them, buy this. It's going to be faster than me shipping it to you in a couple of days. Or you can just go down to the health food store and buy certain things, particularly like earaches. I mean, you can just walk in a Whole Food and treat your earaches. I mean, they got garlic mullein oil right in there that works just fantastic. But you need to have these ready. And I travel with garlic mullein oil, and I have an herbal first aid kit, and I have garlic mullein oil in there because it's so effective at ear infections. And it's just part of my herbal first aid kit. So not only do I have hundreds, thousands of herbs, hundreds of products, I also have an herbal first aid kit too. So I'm very ready, and I'm treating all of my animals as well for cuts and wounds and infections and diarrhea and all kinds of things. I'm even treating animals. But it's all boiling down to taking fast action and being prepared, particularly when you have a big wound in an animal. You have to be ready. I even have surgical knives where, I have an animal with a big wound. I have to cut off the pus. I have to poke a hole in a inflamed, cyst on the animal. I mean, I got all kinds of things I'm ready to do, and I do it all with herbal treatments. And keeping my horse, my dog, my cats, my chicken, my ducks, my doves away from having to take medications themselves, because it just makes their quality of life better. It makes them live longer. And, that's how I have my animals living so long, is I'm taking care of them. But you need to have the same first work on yourself. Be proactive, have herbs ready, don't delay self-treatment, and be prepared. So, a few more tips. Those are like the big picture there. But I think some of these things I mentioned now are going to be obvious, but it's part of the treatment. Only eat organic food. That's right. Well, people ask me why I'm only, paying so much. Even when I go shopping, they can see that I'm only buying organic food. Because now supermarkets, I can go to most supermarket now and still buy 100% organic, even though there's only 10% of the store is organic. It's, people are opening up to the importance of having clean food without all the pesticides and the red dye number 40 and all of these things. Many of these, which we've heard recently, are banned in Europe. There's many things like GMOs and chemicals and pesticides and glyphosate, double spraying, that are all banned in Europe, but not banned in the United States. So, I mean, that's a big eye opener. Whole other countries have banned chemicals and dyes and GMO, and we're still using them. So I would say they got to go. Now, of course, when people contact me when they have cancer, I tell them, okay, everything's got to be organic. And of course, they go, oh, yeah, of course. But they're only doing it now. They're waiting until the health problem comes. And then they go 100% organic. But you want to avoid the cancer. You want to avoid the toxins by, going organic in advance your whole life. Of course, we all go out to dinner, every once in a while. But I would say I'm 99% organic. And even when I travel, I just go from health food store to health food store to health food store right across the state or the country. And no microwaves at all. I mean, microwaves not only destroy the nutrients, but they're highly toxic. I wouldn't even have them in the house. I would never use them. I would never microwave water. In fact, I remember speaking with a Indian doctor who's an Ayurvedic oncologist. That's right. In Ayurveda, there's a whole system of oncology based on herbs. In fact, there's whole clinics, there's whole hospitals that are treating people from all over the world for cancer using only Ayurvedic methodologies and herbal remedies. And I had the pleasure of this woman actually stay in my house. Actually, I invited her husband, who was also a famous Ayurvedic doctor, but I didn't realize the wife was really quite impressive. She was an oncologist specialized in cancer treatment. And I asked her when I was driving her to town to go shopping, I asked her, what is the main causes of cancer that you see? And she said, number one, Teflon pans. She says, I know that's a bigger problem in the United States than it is in a bigger problem in India than it is in the United States, but still, it's a big issue. I would never use these nonstick pans. In fact, recently, I had a client, you may be watching, I don't know, I can see a lot of people just joined, that had Parkinson's and wasn't recovering well from the treatment, so I just said, do a heavy metal test, and sure enough, they had high aluminum and some high mercury. So then I asked him when I did the follow-up after he sent me the test results, you using aluminum pans, you using aluminum cookware, you use aluminum foil, and it was yes. So don't wait until you got Parkinson's or dementia until you start eliminating this aluminum cookware. You don't want it in the house, this nonstick. The nonstick pans are toxic. And the woman went on to say the other main cause she saw was burned foods, charred foods. Once the food is black, it's carcinogenic. And so those are the main things she said. I was just thinking she was going to talk more about, not organic foods and stuff, but that's what she said, the nonstick pans and burned foods. Then I asked her, how come some children are born with cancer? This was my next question. And she says, oh, because the diet of the mother. So if the mother's like using microwaves and having food cooked in aluminum, this can affect the development of the child's brain. Now we know, of course, aluminum kind of calcifies the pituitary gland apparently and prevents the development of the brain and leads to neurological issues and autism and dementia. We now kind of, according to the research, we know that. But if the mother's consuming this aluminum during pregnancy, this is going to go right through the placenta, right into the baby. And we already know that these heavy metals can go right to the cross the blood-brain barrier and go right into the brain and damage the brain of the mother and the fetus. So this is how children are coming out with cancer. In fact, even diabetes type 1 will come from a parent consuming high amounts of sugar during pregnancy. So if you're pregnant, you really have to take this more seriously. But let's keep going. Only organic foods, no microwave ovens, no heavy metals, nonstick pans, aluminum. All of that's got to go. No junk food, no fast food. You think these restaurants are buying good oil? No way. They're buying the cheapest oil they can. They're not using Himalayan salt. They're just using cheap table salt, sodium, so you're getting the cheap oil, uh, plenty of preservatives, extra sugar. I mean, you go to Denny's or a food place like this, they're putting sugar in the pancakes, sugar in the salad dressing, sugar everywhere. And if there's no sugar in it, they're going to load it up with salt, and then they're going to be fried and oily and bad food. So I mean, you just never want to go to a fast food restaurant. There's health food stores all across the United States. So there's really no need to go to a fast food place. Even in the airports, I can find like one healthy place now. When I was traveling a lot a couple years ago, I would get used to the different airports, and I would know where the one health food place is that would say organic food right in an airport. So it's available. And most of the time I would just take my own food, but I did learn that they were there. And of course, you don't want to get rid of all the bad habits that everybody knows is bad. The smoking, the drinking, the partying, the staying up late, living off of coffee and not taking good care of your health and staying active. I didn't say going to the gym and pumping iron. That's not necessary to stay healthy. A lot of the people in the gym pumping iron, nice six pack, looking pretty good. They're over consuming animal protein. They come to me with joint pain, muscle pain, kidney failure, but hey, they're looking good. And a lot of women too are extreme dieters and look great in a bikini. But unfortunately, when they come to me, even I've had models, stewardesses, plenty of health problems, insomnia, neuropathy, dizziness, lightheaded, fatigue, weakness, all from they're depleting themselves constantly by skipping meals, fasting, not eating enough, living off of coffee, and things like that to stay thin and create plenty of health problems. In fact, you could find the most unhealthy people will be the skinny, bony people. They're the ones that are going to have no energy in the afternoon. They're going to be nervous, sensitive to everything, depleted, weak, degenerative bones, hair falling out, menstrual cycle stopping, all because they're depleting themselves because they're over fasting, skipping meals, taking TikTok advice instead of healthcare advice. So you just going to the gym is not the answer, and putting on muscles and being skinny does not equate with health. You got to get that right out of your mind. Now, if you're a supermodel, you got to stay thin. I understand you got to do what you got to do, but it doesn't mean that's healthy. And I'm sure if you're this type of person, you know what I'm talking about. You just look good, but then when you really get down and face facts, a lot of these people have plenty of health problems, often even more because they're only focused on the superficial looks and not focused on the strength, the longevity, and the health aspect of things. And so that's going to take what we're talking about today, avoiding all these bad habits and eating good, staying active, doing organic, and staying away from all these things like microwave ovens and nonstick pans. These are very important. So if we're going to talk about what else we should do, you got to do what everybody did thousands and thousands of years before there was medical care that's only been around, less than 100 years. Really, I mean, we had Bayer aspirin in the late 19th century, but, really, everyday medical care like we experience today has not even been around 100 years. So for thousands of years, people were taking care of themselves. What did they use? No, they didn't have to go buy expensive supplements online with fancy labels. No, they used herbs, herbal remedies. Every person should have herbs at home. Every mother should be good at giving little herbs to their children for cough, cold, earache, sleeping, constipation. You should always be able to treat these conditions by yourselves. Keep your immunity strong. Get yourself to sleep with herbs. I'm taking sleeping herbs almost every night because I'm such a fired up guy. I really have to like use the herbs to just kind of chill me out and make me sleep good. But, they're healthy. They're just ground up plants. It's not like I'm addicted to some sleeping med that's damaging my kidneys, damaging my liver, and creating an addiction. Or it's a hormone replacement like melatonin, where you're just taking something your own body's supposed to be producing and creates another addiction. You should just have some herbal remedies to get you and your family to sleep. You should have some herbal remedies to prevent infection, immune tea, cold and flu tea. You should have herbal remedies when you're constipated, colon tea, colon herbs. And you should have herbal remedies for digestion, gas, or bloating. And then you may have separate little health issues that are just part of your health issue, because everybody's got health issues. I mean, there's nobody who doesn't have health issues. You give me a 10-year-old kid, I can find health issues. So if you ask somebody, how's your health? Everything's fine. They're not in touch with their body. They have no idea. It's just like a car mechanic, asking people, how's your car running? Oh, fine. I'm driving down the road. But the car mechanics can hear the engine. He can see the smoke coming out the back. He knows that car isn't running good. But the driver, he doesn't know. It's the same way. But, same, we're taking care of your car. It's all about maintenance, prevention, and be ready. I mean, I travel with extra oil in my car. I ask with extra fuel in my car. I got a whole tool kit in the back of my car. And both, I have one car 30 years old, one car 20 years old. And you have to really, be proactive to keep an old car going and take it to the car mechanic every once in a while and just let him, check it. Don't wait for the problem. So, even like I said, my own patients, they put off appointments until they have some new major health problem. And unfortunately, they run to the doctor for a little while, find out there's no cure. Then they're on Instagram and social media trying to, grab cures there, which is basically the blind leading the blind. Sometimes they just take a bunch of vitamins and then they end up coming to me. I think it's good to take supplements. I take supplements every day, but not synthetic vitamins. That's another point. I think everybody should take supplementation. Now, I take superfoods, which we also have on our site. Let me just thank our sponsor there, Herbmanteas at herbmanteas.com. And on herbmanteas.com has everything that I'm talking about: sleeping herbs, relaxing herbs, digestive herbs, colon herbs, constipation herbs, diarrhea herbs, and couple immune teas, bunch of immune formulas, cold and flu tea, formulas for bad pneumonia, bad fever. We've had some of those going around, and it's good to have these ready in your house, ready to go, and be ready. But my next point, you should have a team. You have to go see your herbalist regularly, whether it's me. I would go to chiropractor. I like chiropractors. You just have to be real careful taking nutritional advice from chiropractors. They like to, do their thing on their muscular skeletal system. And then while you're walking to the door, try to sell you some expensive supplements. So you got to watch that, the old chiropractic upsell. But I do believe in chiropractors and osteopaths. I had a good friend who was an osteopath, great treatments. And acupuncture, also good. Some acupuncturists, particularly the Chinese ones, are very good at herbs as well. So you could have a good Western herbalist, a good Chinese herbalist, or an Ayurvedic herbalist. I'm an Ayurvedic herbalist and Western herbalist, even though I use about a dozen Chinese herbs. But you need this person in your life, and maybe more than that. Maybe you need a yoga teacher too. Yoga teacher, chiropractor, acupuncturist, and herbalist. You need to have your own team, and you need to do regular treatments. You could, go see the acupuncturist once a month, the herbalist once a month, chiropractor once a week if you have issues. Like, they need to do spinal decompression. You may have to go quite often. But all of these things that you do are to prevent you to have serious health conditions that will require you to go to the ER or go to a medical doctor and feel you have no choice now to take medication or surgery. That's what you're trying to avoid. And that's what this is all about. And we'll just go back and repeat again. You got to be proactive. You got to be maintenance. Same with an old car. Maintenance. Proactive. Not letting little problems become big health issues. And then, of course, being prepared, living the clean life, and etc. And what are the benefits of that? Well, you have a lot of energy. You feel really good. You have good mood. You feel happy. You feel motivated in the day. I got a lot of projects. I got a lot of hobbies. I'm very motivated to do a lot of things, which is why I have to take sleeping herbs at night, because a lot of things I would like to do in the evenings, because I have all this energy and ambition and motivation, and you enjoy life. You have a better quality of living. I just see so many people, even in their 60s, with no quality of living. They haven't taken care of their health. Now they're on 5 or 6 meds. And it's, many of them come to me and decide to change their ways and want to get off of these meds. But it's a big process now. Now they have to take a lot of herbs. They have to take radical changes to their diet. Sometimes they have to learn to cook food for the first time and things like that. So it's a lot of work reversing it. But everything's possible. It depends on your attitude. Attitude is everything. You have to have a good attitude, and you have to be open-minded. If you're not open-minded, then you're living a narrow-minded life, and you're going to miss out on a lot of opportunities. And you have to be positive. You have to make effort to treat yourself. And please don't just only go to social media and Google YouTube and just watch people who are just selling or promoting supplements. You really need professionals who are meeting patients every day. Those are the real ones that usually are not even on YouTube, because they're so busy meeting patients and treatment, and that's their mode, their lifestyle. That's what they do for a living, not make YouTube videos. So, well, I hope that motivated you. I did mention it's been 45 years since I've been to a medical doctor, and I want to keep going. Been decades since I had the cold and flu, and that's all based on that information that I just told you. Being proactive, maintenance. Now, I treat people for high blood pressure, diabetes, cholesterol, arthritis, and then when the pain goes away and the blood pressure comes down and the blood sugar's maintained and they don't need the herbs anymore, because you don't take herbs forever. They're just treating, reversing the condition. Well, then they say, can I stop the herbs? They taste so bad. I want to stop the herbs. I said, sure, you can stop your blood pressure herbs, your blood sugar herbs, your arthritis herbs, but you shouldn't think you want to stop herbs. That's how I've stayed out of the hospital for 45 years, is taking herbs every day. I mean, there's my tea right there. Immune tea, I'm drinking all the time. I just go one tea. I take sleeping tea, relaxing tea, immune tea. And I'm also taking powdered herbs for, all various little conditions that I know are issues with my body. I sometimes can get a little constipated. Sometimes I don't sleep well. Sometimes I get rashes. Sometimes I get itchy. So I'm taking herbs. I'm taking supplements. I'm taking omega-3s. I'm taking food-based D vitamin, not D3. I don't believe in these synthetic vitamins, long-term use. I'm food-based supplements I'm taking every day, 5, 6, 7 herbs. In fact, my staff are very surprised how much herbs I consume, because when I'm done with my bag of herbs, I usually give the empty bag over, put it on the staff's table, because sometimes they may want to reuse it, because they're not sealed when I take them. And they're surprised. I mean, I'm putting an empty bag almost every day or two on the table. So they're realizing this guy is doing 20, 30 bags of tea a month. I mean, I'm just, of course, to me, I don't pay for it. It's on the shelf. So I'm really dumping in the sleeping tea. I'm dumping in the brain memory tea in the morning. I'm doing the brain tea in the afternoon. I mean, they kind of look free to me because they're on the shelf. So I do consume a lot. And I got little teas and capsules and herbs all over my desk. My whole bathroom is full of them. I have bath powders, tooth powders that I'm taking. I brush my teeth with herbs. When I bathe, I put herbs in there. I've got soaps that I've made with herbs. So, it's just constant for me. I have lotions and oils that I put, herbal oils on my body constantly. I would think that I'm spending If we just set aside like oral care, because I probably spend 30 minutes a day just brushing, flossing, and gargling with an herbal gargle, herbal oil cleansing, everything's herbal, brushing my teeth with a herbal tooth powder. Then I floss with a tea tree oil floss. And then I gargle with this herbal mouthwash, which I didn't make, but it is Ayurvedic. I want to make my own. And then an herbal oil pulling, which I don't make. It's sesame oil with a bunch of herbs. I do buy it online. So that takes me 15 minutes twice a day right there. So if we set aside oral health care, which is 30 minutes a day, I would easily spend an hour a day just taking herbs and teas. Now, if we count my herbal baths, which I put special powders in the bathtub for my skin, help me relax, then, 30-minute bath. I like to do bath almost every other night. That would mean I'm spending, an hour and a half, say an hour and a half a day, if we count the mouth, at least 1 to 2 hours a day I'm spending just taking care of myself. Now, I do have 50 animals. I have thousands of clients. So all the rest of the time, I'm taking care of everybody else. But I do spend a couple hours every day on myself. And when I travel, I have to take like a small backpack full of herbs to keep myself going. And people are surprised. I go, so you're still healthy. You never get sick. You have full of energy. You look younger than your age. Why are you taking all many herbs? Well, that's how I'm doing it. So don't think once I've treated you for diabetes, you should stop all your herbs. No, now you can be preventive. You can take colon herbs, sleeping herbs, relaxing herbs, brain herbs. There's no end. You need to be tooth powder herbs. And most of these products, there's almost 200 products on Herbman teas, all, formulated by myself, even though they're very traditional products, many of them. A lot of the herbal products, teas you can see are based on Dr. Christopher's formulas and other famous Western herbalists. And all my Indian formulas are based on Ayurvedic formulas. I don't like to create things myself. I just very traditional person using traditional proven formulas, never looking online, never go with this new research, never going with some new technology. I forget all that. Go with what's been working for thousands or at least hundreds of years. I love my teas. That's a great tea. So tooth powders, bath powders, all can be found on herbmanteas.com. And we're adding more products all the time because there's still more products I haven't even put on Herbman Teas, but we're just so busy packing and shipping. My staff really don't have time to add that many more products, but we still do add them when we can because we really want people to have these products to take care of their own health, particularly oral health, hair health, digestion, elimination, sleep. You should just be doing that yourself. Shouldn't wait until you're insomniac trying to get off of sleeping meds and then decide you're going to start taking some herbs. Just take them. Don't be afraid of them. Get yourself to sleep. Get your bowels moving. People are like afraid of herbs, but they'll be taking 5 meds and not even look up the side effects. So anyway, I hope that helped you. I hope that inspired you to take better care of yourself, be more proactive, be more prepared, and think of maintaining your health so you don't have to go see a medical doctor and can live a better quality of life and live to 100. You should shoot for 100. That's your goal. Ayurveda says we should be going for 120, but we'll settle for 100. Anywhere between 100 and 120. That's where you should be going for. But there's people dying in their 40s and their 50s. And why do they go early? Like one wife told me about her husband who was in his late 40s with a lot of health problems, high blood pressure, diabetes, cholesterol, and kidney failure. And I asked her, why does your husband have so many problems? And she said, he just never cared. And that summed it up. So you have to care. about yourself, and about your children. You can't not care. That's just a straight path to health problems. If you got to care, you got to be proactive, you got to be preventative, and you got to be prepared by having certain herbal treatments. And you have to do regular appointments with your chiropractor, your acupuncturist, and your herbalist to stay on the ball. You have to spend some money here. You just can't sit around and just wait for the big old health problem and then run off to the ER and figure your insurance is going to cover it. It's like too late. Okay, folks, I hope I inspired you and to take care of yourself, take care of your family, get back into herbs, study how to take care of them. I put a lot of notes on Herbman Teas, how these herbs work and who the herbs are for, who the treatment's for, a lot of details I'm putting up almost every night, adding more information about how these products work and who they're for and who should not take them. So more and more, I'm putting more and more information online to help my clients, my future clients, to take care of themselves and be more proactive and not need to go to the medical doctor. All right? Self-care, not medical care. That should be your goal. God bless you all. Thank you very much. Wish you the best of health and happiness.